Hi, this is Dr. Tom Rogers coming to you today with the weekly podcast of the Common Sense MD. Today I want to talk about something very important called hypertension, high blood pressure. Everybody knows what that is. I want to talk about it because a lot of times there's a lot of misinformation about it. It's important. It's been called the silent killer. But there's a lot you need to drill down on a little bit because a lot of people I think are over-medicated for it, or really they don't measure it right. There's a lot of discrepancies in how people think about your blood pressure. So I see a lot of people freaking out at times when they don't really need to. But everybody knows it's a major risk factor for heart disease and stroke. There's no doubt about that. But I want to kind of go over what it is and what to think about with this. Well, what is your blood pressure? Basically, your blood pressure is the pressure in your arteries as the heart contracts. That's the top number. As your heart pushes the blood out, it expands your arteries to deliver blood to your tissues. That's the number that it's at its maximum contraction when that artery wall is stretched out. So that is the top number called the systolic number. Now when your heart relaxes and before it gets filled for the next contraction and your arteries are relaxed, that's the bottom number, your diastolic number. So example 120/80 is a typical normal blood pressure. So that's kind of what it is. You know, when I got out of medical school 40 years ago, we said anything 140/90 or below was fine. And then a few years ago, they revised it to 120/80 or below. I used to tell people the lower the better. Really, I'm not so sure that's true. A recent study found that anything below 140 and below 90 was just as preventative as anything below 120 below 80. So that leaves a whole lot of room for people to play with, really. So a lot of people in turn, I think, got overtreated and are still being overtreated with too many medications for their blood pressure. Again, I always say, look at your lifestyle first. Look at how much you exercise, what you're eating, your weight, your habits with smoking, and maybe salt. You know, salt's something that's kind of overemphasized in my opinion a lot too. But it seems like the more medicines they make for doctors to use, they use them. So instead of really kind of going to the root cause of the problem and maybe treat it more naturally, which you certainly can. And it's a well-known fact. Well, I call it a dirty little secret that doctors, most primary care doctors that are in a pay-for-performance reimbursement system get paid more, and that's most primary care doctors get paid more for putting people on more medications. That's a sad thing, but it's definitely true by the insurance companies. They get bonuses based on how many medicines they put you on because they're trying to get all those numbers as low as they can. And the insurance somehow wants to reimburse them more for putting on more statins, more blood pressure medicines, etc. So that's really a wrong thing to do, but it's definitely leads to over-treatment. And there's a lot of side effects of these blood pressure medicines, as you know. And it's especially true of aging patients. You know, I treat adults for the most part, and as they get older, they get left on these medications that they may have not have needed in the first place, and their blood pressure gets too low, and they can't figure out why they're so tired all the time. And they don't metabolize these medications like they used to. So I'll have people come in all the time, and their they say they feel weak and dizzy, and their blood pressure may be 120/80 sitting down, but when I stand them up, it drops down to 100/60. And they're tired and weak. They're over-medicated in that case. There's also people that underestimate it and their blood pressure runs too high all the time. So you have to really look at it, and you have to really measure when you're sitting and standing routinely. And everybody needs a home blood pressure monitor. There's no doubt in my mind. I use a Welch Allen, and I check it a lot. because, it varies a lot. But it's much more important what it's doing at your home over several measurements than it is one time when you're in your doctor's office. You may have white coat hypertension when it's elevated just because you're a little nervous or something. So watch it over time. If you could do 24-hour blood pressure monitors, they're just about impossible to get a hold of. It's even better, but just get your own really good blood pressure monitor at home. And if there's any questions about how accurate it is, take it into your doctor's office and have them check it against the manual way we do it, where we use our stethoscopes. And again, even with that, there's a lot of variation. A lot of times I'll ask 2 different nurses to check it, and you get 2 totally different numbers because their hearing may be impaired. So I certainly think the automatic cuffs, a good one, are fairly accurate. But there's nothing that replaces a good set of ears with a stethoscope, in my opinion, because you have to know which sounds to listen for, etc. But anyway, the at-home monitors are pretty accurate. They're pretty telling. So anyway, mine's a Welch Allen. There's a lot of other good recommendations. But, you need to check it because it's really very important. Now, what is a hypertensive emergency? When you need to go to the emergency room or contact your doctor or have some medications at your house to bring it down. In my opinion, that's when you get to 200 over 110, that's an emergency. You need to either go to the ER, or if you have medications, if this has happened before and you have medications to bring it down, then you need to do that. But certainly if you have a severe headache or chest pain or shortness of breath, you have a pressure like that, you need to go to the emergency room. There's no question that high blood pressure can put pressure on your heart, your brain, all your organs. All this end organ damage that we talk about can certainly be true. What causes high blood pressure in the first place? About 90% of the time, the doctor will call it essential hypertension. In other words, they don't know why it's caused. They'll say, well, it just must run in your family or something. And certainly it can be, anything can be genetically transmitted, but most of it's lifestyle. So you can't just say, well, you inherited, here's your medicine, or you're eating too much salt. That's another common phrase that doctors tend to use. I used to use it all the time, but really only about 20% of people are sensitive to salt with their blood pressure. And salt is something that you really need. It's a good thing to have, so you got to be aware of that. So it's a very small percentage. A very small percentage of people may have renal artery stenosis, where their renal arteries to the kidneys are blocked, and that can be corrected. That's rare, and it's usually pretty severe. And it usually doesn't respond to medication. So what causes it? Really, for most people, it's a circulation problem with blood vessels that are damaged. We call it endothelial damage or dysfunction. And this usually results because of inflammation and insulin resistance. Remember that. It's not because your cholesterol's high. It's because of insulin resistance and inflammatory damage. And this could be a result of your lifestyle. What you eat, lack of exercise, being obese, eating, terribly high glycemic foods. Another thing I think can cause it's anxiety, something that walks into my office every single day into every doctor's office, and it can cause real problems. It can raise your cortisol levels. If you're chronically stressed out and anxious, you're probably going to have high blood pressure. And, there's ways of getting around that don't necessarily mean a medication. So these underlying causes are usually not addressed, leading to overtreatment with medications, especially in older people, whose arteries naturally get stiffer. I'm close to 70 years old. My systolic number runs higher than it used to. But really, think about it. These older people that get a little calcification in their arteries, are a little stiffer, really they need that. They need a little higher pressure to perfuse their brains and their hearts. So, I wouldn't freak out over a level at my age of, 135 over 85. I don't treat anything that's not, set level or below, really. I just think the side effects could be worse than, not treating it at all, or certainly with lifestyle interventions. And of course, I look at each individual case. Remember that. I always talk to your doctor about all his issues. Because remember, all medicine is opinion. But hopefully with somebody with some experience can guide you down the wrong pathway, the right pathway. But in any event, I see so much over medication that they get hypotensive. Their blood pressure is too low, and really the mortality from that is higher than the mortality for mild to moderate hypertension. So be aware of that. I'm not going to go into detail about the different kinds of blood pressure medicines that we have. There are many, and they work in different ways. But basically, they either loosen your arterial walls, they reduce the total blood in your circulation, or they weaken contraction of the heart. Every one of them can cause side effects. I tend to use a class of medications called angiotensin receptor blockers, ARBs, as my first line, because they just don't cause as many side effects. And they also protect your kidneys, kind of like an ACE inhibitor does. And I don't like ACE inhibitors too much because they can cause a chronic cough in about 30% of the people that take them, and they can cause a really bad reaction called angioedema. I've seen several people have to get intubated after their first couple doses of that in the ER. Every ER doc's seen that. So I don't like lisinopril. I think there's a better way to do it. I don't use a lot of beta blockers because they slow your heart rate down, make you tired. Unless you have a lot of arrhythmias, then I will use them. Alpha blockers, unless I'm treating prostatic enlargement, I usually don't use them much at all for hypertension. And I never use hydrochlorothiazide, HCTZ. That's the first drug I was taught to use. It was number one in that step-line therapy that we used to recommend that we no longer do. But I see a lot of people still on HCTZ, which is a diuretic, but it's also very inflammatory to your arteries, so I don't use it. I tend to use it, if I need a diuretic, I tend to use something called spironolactone. I think it's much safer, much better. A lot of people use calcium channel blockers like amlodipine, and I sometimes use these when I can't control it with an ARB. But I like the lower doses of this because less side effects. That when you move up on the dose, you get more side effects. Natural things you can do, still berbeриne's probably my favorite natural medication for blood pressure, cholesterol, and pre-diabetes. I love berberine. I love aged garlic. I love hawthorn for this. And there's some other ones that will really work pretty well. But I'm just amazed at how many blood pressure medicines people come into my office on. Usually way too many, and sometimes dangerously. Rather, let's get to the root cause of the problem. And don't freak out over mild elevations. I have people that freak out, they get over obsessed with a 140 over 90 when they really shouldn't. So don't freak out about that. Look at all the other things you can do, like eating right, exercise, sleep. Always rule out sleep apnea, major cause of high blood pressure and arrhythmias like AFib that we see so much of. So if you have any clue that you may have sleep apnea, like I do, rule that out with a home sleep test. We order these all the time. Learn how to relax, learn how to meditate, and work with a doctor who will listen to you and try to get to the root cause of the problem rather than just add another medication. So look at your medicines you're on, measure your blood pressure, think about it. It is a risk factor. They don't call it the silent killer for no reason, so it's a major contributor. But don't freak out. Approach it in a holistic way. Look at everything. And then when you need to use medications, use the ones that don't cause a lot of side effects, that are very safe. So I hope this helps. Check your blood pressure today. I'll talk to you next week.